Your mobile phlebotomy business is leaving money on the table because you haven't understood the Medicare policies that can either make or break your billing game with your mobile phlebotomy business. So I need you to stick around because in this video, I'm breaking down the specimen collection fees, eligibility rules, and the hidden details that most phlebotomy providers overlook. See, the providers impacted by this include laboratories, phlebotomists, and other healthcare professionals who bill Medicare administrative contractors, which is called MAC, for specific collection services underneath Medicare Plan B. So this specifically applies to phlebotomists working with Medicare Plan B patients that are partnered with nursing homes. This is why it's important for your billing staff or the laboratory's billing staff to make sure that they know the specimen collection fees and the travel allowances for the year of 2024 and when the policies update for 2025. And yes, Medicare Plan B will pay a specimen collection fee when it's medically necessary for phlebotomists to draw a specimen from either a nursing home patient or a homebound patient under Section 1833 of the Social Security Act. So you need to know that the specimen policy for collection for the calendar year of 2024 literally went from $8.57 to $8.83, and per Section 1834 of the Protecting Access to Medicare Act 2014, also known as PAMA, and this will increase the price by $2 for those specimens you collected from a Medicare patient in a skilled nursing facility or by a laboratory on behalf of a home health agency. So now, phlebotomists, this gives you a payout of $10.83 for the collection fee for that specific patient. But to be eligible for a specimen collection fee, the specimen specifically needs to have these three things. First, the specimen must be used to perform a clinical diagnostics laboratory test, or CLT, and it's paid underneath the CLFS regulations. And that's the clinical laboratory fee schedule. I know, a lot of acronyms, but you'll get used to this with your mobile phlebotomy business. The specimen also needs to be collected by a trained technician from a Medicare patient who's homebound or is in a non-hospital inpatient, and if there aren't any qualified phlebotomists available at that facility to collect that specimen. And finally, the specimen must be collected as a blood specimen through venipuncture or a urine sample collected by catheterization. Now, a specimen collection fee will not apply to blood samples collected with minimal effort, such as a routine culture or capillary punctures for clotting or bleeding time tests. And guess what? Medicare is only going to allow one collection fee for each type of specimen for each patient encounter, regardless of the number of tubes or specimens drawn. So if you draw different types or multiple specimens from one patient, Medicare will only allow one specimen collection fee for that patient. So even if you do an A1C on the patient, a glucose tolerance test, a HIV test, they will treat that as a single encounter. See, Medicare don't play. And catch this, Medicare patients in the facility where they're not bedridden and the facility already has a qualified phlebotomist on staff, Medicare ain't paying a separate fee to a visiting phlebotomist who comes to collect the blood sample. And they do this because facilities is expected to use their own staff to draw blood from the patient, and they cannot bill Medicare for an additional collection fee from a visiting phlebotomist. And if this all makes sense, phlebotomists, I need you to comment "makes sense" in the comment section. So to sum everything up, we covered how the updated Medicare policies for 2024 affects laboratories, phlebotomy businesses, and other providers. We've discussed the specimen collection fee, the importance of the proper billing practices, and eligibility requirements for collecting specimens from Medicare patients. This is including nursing homes and homebound patients. And if you found this information helpful, I need you to do me a favor and hit that like button, share it with a phlebotomy colleague, and subscribe to my YouTube channel for more insights into Medicare policies and starting your very own mobile phlebotomy business. Thanks for sticking around.